The purpose of this course is to provide those amongst you who intend to heal the gentlest and the most sacred of arts, to provide you with self-knowledge. You carry around with you an object, a body, which incidentally is not a principle, like the astral body or the mental body or the Buddhic body. You carry around with you an example of what you're trying to heal. And if you understand something of your own body, it makes it easier when you approach the body of somebody else. And so my subject tonight is calculated to provide you as prospective healers with something about yourselves that can help you to understand others. I think one of the most dreadful experiences in the esoteric world is to hear healers talking about medical, pseudo-medical, esoteric conditions which they know nothing about. Let me give you an example. I very frequently hear people talking about hypertension. Hypertension as if it was a condition which was related to tension. It's nothing of the sort. Hypertension has nothing to do with tension. Hypertension is raised blood pressure. Raised blood pressure. And you might get an individual who is leading a completely calm life, non-stressed life. And that person's blood pressure may rocket merely because he has taken an excess of salt. No stress in his life at all. And when you hear the word hypertension bandied about, and you know that the person who is using the expression hasn't the faintest idea what it is, it can be very upsetting. You should never make this sort of mistake. You should know that the so-called pain of indigestion can be very frequently felt in the region of the heart. And every person who gets a burning pain in the heart is not a person about to have a heart attack. It is usually, not always, but it is usually indigestion. Some of you perhaps don't even know that when the heart really is affected and shows pain, it may show its pain in the jawbone. And a pain in the jaw may be indicative of a heart that needs attention. Liver pain is frequently felt in the shoulder blade, the right shoulder blade. Appendicitis pain, instead of being characteristically always felt on the right-hand side of the abdomen, may be felt in the middle of the abdomen or even on the left-hand side. And there are many things which are very, very simple about the human body that you should understand before you go wading in to the healing part of your intentions. Man, know thyself. It applies in the field of teaching and also in the field of healing. Never think that you can substitute for a medical training. You can't. You must accept the fact that you can't do it. You wouldn't take that from a medical person except me, because I am absolutely wedded to the esoteric, and you must take it from me. You cannot substitute for a medical training. And therefore always remember to clear your patient with the patient's doctor. Make sure that the condition that you are being asked to treat is one that has been dealt with as far as possible by the doctor. I know this is hard for many of you, that it is the safe way, it is the way in which you will do service to the patient to the utmost degree. Clear him first with his doctor. Make sure of it. Render unto Caesar that which is Caesar's. Let the doctor have a look at him, and you yourself go for the subtle bodies. Go for the subtle bodies. I've given in my book, Esoteric Healing, at least 15 or 16 maxims of how to go about esoteric healing. And one of them is render unto Caesar that which is Caesar's. Let the doctor have the physical body. Once that is cleared, then you can get down to the causes, which in 90% of cases lie in inner vehicles. Now this is a course, the next 6 evenings, this is a course calculated to give you knowledge, to help yourselves, to practice on yourselves. If you're going to practice anything, don't go and practice on your patient. Practice on yourself. Poor knowledge of himself is the curse of mankind. Poor knowledge of himself is the curse of mankind. And for healers, it is even more important to know yourself. And therefore, do see that you never act blindly in healing. Don't think because you've got the patient there and you don't know what's wrong with him that you can advise anything. Don't act blindly. Even the medical profession makes an absolute dogma out of consulting with each other. If you don't know, don't act blindly. Consult others in your group. That's why you have healing groups, is that you share knowledge, you share wisdom, and with wisdom goes love, and with love there goes healing. To give you an example of poor reasoning, let me take one from history. There was a very famous astronomer, scientist called Huygens. I would like to call him Huygens. And he had made certain incredible deductions about the solar system 200 years ago. He said, for instance, that Venus almost certainly had a heavy atmosphere of clouds. And he was right. And he came to his conclusion by deduction. He also deduced much about the rings of Saturn. And he was right, long before our telescopes picked these planets out. But he made an appalling deduction with regard to Jupiter. This was the way he reasoned. It gives you an idea of how false reasoning, especially in esoteric healing, can lead you into absurd conclusions. He observed the 4 moons, at that time anyway, of Jupiter. And he concluded that if there were moons, 4 of them, just as the Earth had a moon, here was Jupiter with 4 of them, he concluded if there were moons there, then there must be mariners there. Because the moon always was a great guide to the mariner. And the moon provided the mariners with a high tide so that they could clear the harbors. And he concluded that if there were mariners there, then the mariners must sail in ships, and if they sailed in ships, then they must use ropes, and therefore hemp, which is what rope is made out of, must grow profusely on the planet of Jupiter. Now, we smile at such conclusions. I've no doubt in 100 years' time that science will equally be showed to, other scientists will equally show to have been fallible. But I heard in a healing group not so long ago a similar sort of statement made. I heard somebody say, well, of course, the animals are there to be eaten. Eat animals because they're there to be eaten. And it was a very strange deduction. We might equally say that if animals are there to be eaten, that the grass is there for the animals to eat. And the grass is there only because the sun gives the grass the glucose to live on by photosynthesis, and therefore the sun exists so that man can eat. And this, of course, is an absurd deduction. And in esoteric healing, we must be very, very careful what we're doing, because you're dealing not with a philosophy, you're dealing with patients, real, living beings like yourself. Of course, the answer to that last anomaly is that the animal kingdom is there to provide a transient state of subtle material for monads to express themselves in. The monads express themselves, as you and I have done, in plants, and then in animals, and then in human beings. And they're a transitional stage of this expression. Also, be fearless with regard to science. Don't let scientists kid you that because they're scientists, so-called, that they can frighten you. Remember that science makes many, many mistakes indeed. Can you believe that the leader of the French Academy of Science was once shown the phonogram, that is the gramophone that, was it Edison who produced it? Or was it Bell? I forget now, whoever it was. Anyway, he was shown this instrument and asked his opinion of it. And he says it's fake. It's absolute fake. It's a trick of ventriloquy, that's what it is. The first time he heard the gramophone playing and the recorded voice. He made a mistake, a terrible mistake. It was the same time when other French scientists were denying that meteorites were possible. even though the damn things were coming down and making holes in the roofs of Parisians' houses. They denied that these meteorites could be coming from outer space. They must be coming somewhere from the earth. They were thunderbolts or something. So do remember that science itself can often make mistakes. Now, the course that I'm going to give you tonight is a long one. It's hard going, but it's eminently understandable. And by the end of the evening, if you will bear with me, that I shall give it to you in simple language, you will understand something about the following disease conditions: arteriosclerosis, which is the hardening of arteries; heart attack; heart pain; heart block; a stroke; rheumatic heart; iron deficiency anemia; high blood pressure; inflammation; and varicose veins. And therefore, the anatomy that I'm going to present to you tonight is calculated to assist you to understand some very common disorders. You're going to do esoteric healing. Very, very soon you will come across such conditions. And so we will deal tonight with the subject of the blood system. We have to remember that every part of the body needs oxygen in order to function. The body is made up of countless millions of cells, and a cell is a machine. The living organism, but it's a machine, and the machine does work. Every cell in your body does work, and if anything does work, it needs energy. And the way in which the cells of the body obtain their energy is through burning glucose in oxygen, basically anyway. We call this respiration. You have to clear out the cobwebs in your minds with regard to many things. Think of respiration as just breathing in and breathing out. There are two kinds of respiration, and one of the respirations that you must understand is the burning of glucose in oxygen inside every cell, and that is called internal respiration. Without this, the cell cannot do its work. It cannot even grow, cannot manifest. And every cell of the body must receive oxygen. Not one is exempt. Oh yes, there is. There is always the exception that proves the rule, isn't there? And that is the surface of the human eye. The surface of the human eye, because it is always kept wet, it is able to get its oxygen directly out of the atmosphere. It would be unfortunate for us if we had tremendous arteries covering the front of the eye, wouldn't it? So we don't have tremendous arteries covering the eye. We have no arteries. And the surface of the eye has no oxygen supply by means of blood. The blood carries oxygen to all parts of the body. Therefore, I always put, in teaching human anatomy, I always put a discussion on the blood system first, because no matter what part of the body you're talking about, we're talking about a blood supply. So that's the first thing to understand. Now, there is something that has come out in the last week that is tremendously important to you as a group of healers. And it's in Scientific American, September 1975. How many people read Scientific American? See what I mean? Yes, you must. It's eminently readable. It was created for you. Start getting them. Start getting them and plod away at them. Share them in your group and bring some of the subjects out and discuss them. What is it that I have to say that's so important? Scientific evidence has shown lately that the skin is permeable to oxygen. Now, we all of us say, surely it would be possible to absorb oxygen through our skins. It isn't. And that's not what we're talking about. What science has discovered is that oxygen can come out of the skin from the body, and that the circulation of the blood in the body, carrying oxygen as it does, is able to be so efficient that oxygen can come out of the body through the skin. And what can produce this? Any heating of the skin brings oxygen quickly to the surface, out of the blood, quickly to the surface of the skin. Have you never seen, as I saw on Sunday night in Houston, Have you never seen healers rub their hands and put them against the body to get wonderful effects? Rub your hands and feel what happens. Come on, rub them hard. Can you feel them get hot? And if oxygen is coming out of them, what is coming with it? Prana. Prana. Yes. And so when you put rubbed hands next to a part that is diseased, is lacking in vitality, you are pouring prana into it. And the healer is a person who is vibrating energy. I remember as a little boy getting out of my bath and feeling, oh, hell, must I really put my clothes on so soon? I would use any device to put off that moment of having to put clothes on. People who know me closest know that whenever I can, I've never got any clothes on. And the way in which I used to be able to put off the awful moment of having to wear clothes was that I used to slap my body all over like that after a bath. And I don't know, I always noticed that I used to feel wonderful after a bath, and it wasn't just the bath, it was the slapping. And I'm not kinky. There is something there that brings the blood to the surface, and a person radiating, bubbling over with apparent energy, heat energy if you like, is a person who's giving out prana, and it's coming through the skins. And if it's going to come anywhere, it's going to come out of chakras. Remember where the chakras are. Not just the major chakras, which are important. They're in the palms of the hand. They're behind the knees, in the elbows, under the armpit, the axilla. Wherever there are folds and creases in the body, there are chakras. So do remember this. There are many, many implications about this fact that oxygen can be donated from the surface of the body. The classical condition where this should work would be leg ulcers, where you have a devitalization of tissue, Don't go and stick your dirty fingers into the ulcerated hole in a person's leg. You need just to rub your hands and bring them close to that region. You have observed careful hygiene. Of course, you can put the palms of the hands around that area where there is ulceration. I've described this in my book, Esoteric Healing. I had one of the greatest pediatricians in England, Professor Illingworth, teach me pediatrics. We would walk round the wards with him, and the baby would cry. And if that baby was not attended to immediately, he would swing round and say, "Nurse, pick that child up." The nurse would hurry over and pick the child up, and immediately rub the child's back, especially up and down the spine, which was what he recommended. Again, this is what a child may be crying for, needing energy, something to shift, something to move an organ that can't. I think you talk about wind having to be moved. Well, it works. It works. Holding the baby, clasping the baby, especially if you are radiating the prana from your skin. Very important. Adam Blavatsky wrote 90 years ago this about the blood. She said, the circulation of the life force through the body is by way of the blood. Circulation of the life force through the body is by way of the blood. She said the blood is the vital principle in us. It is pranic rather than prana. It is pranic rather than prana. She also said, and this is very important, that the white cells of the blood, and we're going to know all these things by the end of the evening, the white cells of the blood reflect the emotional energies of the person and of people about that person. There is something strange about the amoeboid kind, and we'll talk about amoeboid white cells later on, the amoeboid kind of white cells. They somehow or the other reflect emotional tension, emotional atmosphere. And according to her, it is these cells which are responsible for psychometry, the picking up of an object and feeling something about it, the walking into a room and feeling an atmosphere that is full of love or full of hate, a wall of hate, or an encouraging embracing of love in the atmosphere. She says, the white cells of the blood. Paracelsus, the great prince of physicians, in the 16th century said, blood is a very special fluid. We're beginning to find through radionics that blood is indeed a very special fluid. And even though the blood is taken away from the body, it still reflects the kamaloka. You want to use the old theosophical expression. The kamaloka, K-A-M-A, not the karma, not the karma, the karma, the emotional nature of the individual. And according to the Tibetan, 90% of disease can be traced to the emotional nature and the mental nature rather than the physical. And so we're talking tonight about a very, very important anatomical material, a tissue. Blood is tissue. I'm not going to make any mistakes tonight in the words that I use, because I know that there are 50 of you here who could go away and make the same mistakes, and so I'm being very careful. Blood is a tissue. The first thing we need to understand about the blood is what it does. The blood supplies cells with oxygen. What are cells? A cell is a minute organism. A globular cell, let us say for instance the female egg, the ovum. A globe about 1/200th of an inch in diameter, with a nucleus, a cell on its own. But the body is full of cells. There are the long nerve cells, which are something like that. And a nerve cell may be 3 feet long. Have a nerve cell from the tip of the toe to the spine, another one from the base of the spine to the brain, and a third one into the cortex of the brain. And so cells are tremendously different in size. You can't see a blood cell with the naked eye, but you have a nerve cell can be 3 feet long. The difference between the two being the difference between a court of peace and the capital of a city, the Capitol building of a city. The difference in size between body cells. And so we get all kinds of cells. Muscle cells that can contract and reduce themselves to a bulging little object like that. Muscle cells, again with a nucleus. The characteristics of the cells are these. A central nucleus, which decides what the nature of the cell is, decides when it's going to divide, multiply. It is the organization center, the nucleus of the cell, a region of activity called the cytoplasm of the cell, and the outer membrane that holds the cell in, the skin of the cell, if you like, or membrane, cell membrane. And those are the 3 characteristics of all cells. We get liver cells, we get kidney cells, we get flat cells that look like paving stones making up our skin, like that. Flat paving cells, what we call squamous or pavement epithelial cells. And so every part of the body is divided up into these little organisms called cells. And as I said a little earlier, they all do work. And therefore every one of them must receive oxygen. And therefore every one must be supplied with blood. Every one must be supplied with blood. Whatever the cell is in the body, there must be a blood supply to it, because the blood brings the vital principle. The vital principle is contained in the oxygen molecule. We'll be talking about that in a moment. How are these cells fed? Well, they're fed with oxygen from blood vessels. It means this: if that's a blood vessel there, let's make it look like a blood vessel. It means that oxygen has to leave the blood vessel and go into the cell. But the blood also takes away the waste products from the cell. The cell is an organism. It's like a machine. And a machine has exhaust fumes. The exhaust fumes of the cell are carbon dioxide. And so, whilst the blood delivers oxygen to the cell so that it can burn sugar and do its work, at the same time the exhaust materials are taken away by the blood. And in this case it would be carbon dioxide. And so we're talking about the blood system as a transport system. It's the way in which all the things that the cells require get them. It's a transport system. That is the most important thing to remember about the blood. It's a transport system. And the blood must therefore carry all the cell's needs. And the cell may have dozens and dozens of needs. The blood has to supply it. And so blood is a most important thing, The quickest poisons act through the blood. If it's cyanide, it can kill you in 20 seconds. It can stop the cells from absorbing oxygen, cyanide. If it's snake poison, it can cause coagulation of the blood. It can cause breaking up of the blood vessels, so the blood vessels burst. But the quickest poisons are inevitably those carried in the blood. Cyanide can be smelt, but the smelling of the cyanide, the smell of it doesn't kill you. It is the moment that the smell, that is the gas of the cyanide, enters into the blood system, that kills you. And so the blood is terribly important. Now let's look at what blood is. If we took some blood, we know that if we let it stand for a little while, there's some blood. If we let it stand for a while, a strange thing would happen to it. It would begin to break up into a yellow material, and right in the middle of the yellow material, a clot would form. A clot would form right in the middle of it. Blue, brown, purple shaped, colored clot. That would be changed into that. And therefore we begin to understand then that the liquid part of the blood is a sticky, viscous, yellow material. It's a yellow liquid. The blood is about 90% water. 90% water. So one of the things that happens is that the blood clots. A lump forms in a yellow fluid. A lump forms in a yellow fluid. What is the lump made of? The lump is made of, ladies and gentlemen, is made of mainly cells. And therefore, if we took this yellow fluid, we added a lot of cells to it, the correct number of cells, the cells would move around, float around in the yellow liquid, and eventually that looks like blood. That's why the blood is red. Blood is not red, it's yellow. You cut yourselves, get a little bit of a blood flow, then the blood clots, as I've shown you there, and then maybe if you squeeze the cut, you'll see a little yellow fluid come out, yellow material come out, and that's the substance that the blood really is. But suspended in it are so many red blood cells that the blood appears to be red. So, that's the first thing we need to understand about the blood, that it is a tissue, it's a fluid, it's so sticky, and suspended in it are red cells. What do the red cells look like, and how many are they, and why are they there? Remembering all the time that Blavatsky said that the blood itself was the active principle in man. It carried the vital forces in him. Now, if we looked at one of these little red cells, we would find that it was disc-shaped. It was disc-shaped, something like that, except that around the edges it is thicker. It's like a plate with a dent in the middle, except that the central part is almost, well, let's say paper thin, and the edge is much, much thicker. And this is what a red cell looks like. If we cut the red cell in half, and turned it up on its edge, we would see this effect. The thin part is there in the middle. That's where I've cut it in half, and there's the other. Get the idea from that picture? There's a red cell cut in half with a dimple on the top and the bottom. The reason for the red cell being shaped like this is that it allows oxygen to diffuse into it very quickly. When it's loading up with oxygen, the oxygen can get in. If it were a perfectly round spheroidal shape like that, there would be a long distance for the oxygen to have to move through in order to saturate the cell. Now, this cell is in the lungs, and it's presented to the oxygen in the lungs for a split second, a 20th of a second. In the 20th of a second, it has to load up with oxygen, and that's why it's made in that shape, so that it can absorb oxygen very, very rapidly in that split 20th of a second whilst it's in the lungs. How many of them are there in the blood? Well, the blood is made up, in average person, of about 10 pints of it. 10 pints of blood in the average person. The red blood cell is so small that if we took a pinhead of blood, there's a pinhead, we took a pinhead of blood, we would find that there were 6 million red cells in a pinhead of blood. 6 million red cells in a pinhead of blood. And we have about 10 pints of blood in the body. A vast number of red cells, you would agree. And they're very, very tiny. When you see them under a microscope, you see them as tiny little flat discs. Thousands and thousands of these tiny little flat discs like that, making up the blood smear, as it were. So this is the red blood cell. Why is it red? It's red because it contains a pigment called hemoglobin. Hemoglobin. A red pigment called hemoglobin. And this pigment contains an enormous amount of iron in it. An enormous amount of iron. Why should the red cells, or the blood for that matter, be loaded with pigment? Well, let me tell you why. Any of you have got goldfish. Many of you watch your fish swim around, and you know that if you don't oxygenate the water, the fish will die. Put them into a fair-sized tank, and you can calculate, if it hasn't got an air pump, you can calculate that the fish will live there for about 3 days, and then you'll have to change the water. They're getting air from the water. If you fill the tank with blood, they could live there quite comfortably without your having to change it, because the blood would carry 30 times as much oxygen than water would. And if we had a blood system of water, as we did once, way back in the second, third root race, when we had, or rather if we had a blood system of water, we would have to have a completely different method of oxygenation. We would need 30 times as much blood, for one thing, if it was just water. But this material, this red pigmented material made up of little cellophane bags containing pigment, which we call red cells, loves oxygen. And it will take up 30 times as much oxygen as water will. And that's why we have this red pigment in the blood. And you can understand that if we don't have enough of it, or the red cells are not good, not properly shaped, misshapen, not properly formed, then we will be suffering from the inability to carry oxygen around the body. And this would be anemia. Anemia. Where there's something wrong with the red cells. I'll give you the basis for anemia later on. Something wrong with the red cells, can't carry oxygen, and therefore we're starved for air. We're always tired. Why? Because the cells cannot burn energy. You've got no energy. You're anemic. The cells are short of oxygen, and although they've got the sugar there to burn, they can't do their work because they've not got enough oxygen. So that's the basis of anemia. Now, when we stand the blood that I was talking about here, when we allow it to stand and we put an anticoagulant into it, some powder, to stop it from clotting so it won't do that, we find that after a few hours, we find that the cells have settled out. There's the plasma, there it is, the yellow plasma, and right at the bottom there is a layer of red cells, and on top of them is a thin layer of white cells, like that. That's what happens to blood when you stop it clotting and just let it settle. Red cells, white cells on top of them, making a thin layer, and then the yellow plasma. This is about 40%, and this is about 60% of blood. So that's the composition of blood. Or rather, I should say that's the main composition of blood. We're beginning to understand now its nature. But it must have more than that, much, much more than that. Contained within the blood there must be everything that the cells need. It must have sulfate, sulfur in the blood. Sulfur is needed to form proteins, needed to form nucleus of a cell. The cell needs magnesium. The bone cells need calcium. The nerve cells need potassium. The nerve cells also need chloride or chlorine. They need sodium. The red blood cells need carbonates. And the bone cells also need phosphate, so do the nerves. And all these materials, in the most delicate trace conditions, have to be in the blood. You name a mineral element, and the blood is so like seawater. You know that you can get a trace, almost any trace element, ultimately from seawater. And I mention this because in many animals, seawater, the amount of salt in the seawater and so on, is a reflection of the sort of liquid that the blood is made out of. The other thing that the blood needs is proteins. And you should make a note of this: albumin and globulins, very important proteins in the blood. If you haven't got enough albumin and globulin in the blood, then you will tend to suffer from edema, swelling of your tissues, fluids being held in undesirable places around your ankles and places like that. Then a third thing that is found in this blood is urea, U-R-E-A. What is urea? Urea is a waste material made mainly of nitrogen. It is a white powder. You ever seen a little boy with black trousers on or blue trousers on, and he's wet himself, not once but half a dozen times, and it's dried out, and you see white material on his trousers? This is urea. It's a powder, seen as a white powder when it's dry. It is the waste product of proteins. Half of all the meat and fish and protein that you eat is waste. Say it again. Half of all the protein that you eat is wasted. That's why we say that protein is one of the most wasteful materials on the planet. And to eat more than is necessary seems to be depriving others of food. And so urea is a waste product, and it floats around in the blood. And the kidneys have to get rid of it, or you get uremic. You go into coma. So much of the urea is present that you get toxic. You begin to lose consciousness. Uremia. Whenever you get the word emia, emia means blood. Urea in the blood. Emia means blood. Anemic. Something wrong with the blood. So, what else does the blood carry? It carries the food for the cells, the sugar for the cells, sugar in the blood for the cells to burn. Otherwise, they can't do their work. Blood must carry all the foods necessary for the cells. And then finally, the blood must carry things like hormones, estrogens, progesterone, testosterone or testosterone. Hormones must be carried in the blood, chemical messengers. The thyroid hormone, coming from the thyroid gland, must pass in the blood to tell the cells how fast to work. That's all the thyroid hormone does. Decides how fast the cells will work. And that hormone can only pass to the parts by means of the blood. There is something else that I must just mention before I move on. And it is this, that contained in the blood is a lot of white strands. It's a protein called fibrin. Fibrin, F-I-B-R-I-N. And this is the material that allows a clot to form. And the clot forms, there's a lot of streaks of this proteinous material with the red cells caught in it like a trap, like a net. The fibrin is long proteins in which the red cells get caught up. When the blood stands, these white protein molecules form. In fact, when you take standing blood and put a glass stick in it and whip the glass stick around in it, you can pull it out and it's got lots of strands of fibrin in it. The mechanism of clotting, protein material that allows things to clot. So this is what we mean when we say that the blood is the great transporting system. Now I must just briefly mention the aspect of prana. We know that attached to the oxygen molecule there are vitality globules, as many as 10 on a molecule of oxygen. Vitality globules containing prana. Vitality globule contains 7 ultimate atoms, which we call anu, and the atoms are bound together with prana. Prana binds these ultimate atoms together in a vitality globule. You've heard me talk about this 1,000 times. The vitality globules attach themselves in sunlight to the oxygen molecule, and the oxygen molecule is breathed in a way that we'll discuss in later talks, and the oxygen is absorbed into the red cell. It's absorbed into the red cell. It's attached to iron molecules. Inside this red cell there is this red pigment called hemoglobin in molecules. There are about 280 million molecules of hemoglobin in a red cell. 280 million molecules of hemoglobin in a red cell. And the hemoglobin loves oxygen. And each little hemoglobin molecule is like a cross in the respect that it can take 4 oxygen molecules. One there, one there, and one there, and one there. 4 oxygen molecules to each hemoglobin molecule. So let's put some figures down. 280 million molecules in each of hemoglobin in each red cell. To these are attached times 4 oxygen molecules, that equals O2 oxygen molecules, and we know that there are 10 vitality globules to each oxygen molecule. So we could say that each red cell, and there are 6 million of them per cubic millimeter, I'm deliberately just making you gape here, don't take the figures down. I'm just trying to show you that in each red cell there are, or it has the potential for carrying 6 million times 280 million times 4 times 10 vitality globules. Each red cell has a capacity like that. What does it work out at? Something like Zeke, you should know, 10 to the power of 16, or 10 with 16 noughts after it. That's the number of vitality globules which can be attached to a red cell. And that's important, ladies and gentlemen. It is not just the oxygen that we are dealing with in esoteric healing. We are dealing not only with oxygen that the cells need, but we are dealing with prana, which the etheric part of the cell needs. A prana that the etheric part of the cell needs. Hovering over every red cell, hovering over every red cell and interpenetrating it is its etheric body. And this is what Blavatsky was referring to. It's the etheric body interpenetrating the red cell. And it is the prana that feeds the etheric part of the red cell. And so this is what's going to all the tissues. Oxygen from the red cell, certainly, but also the prana. That's what Madame Blavatsky meant. And she said that the blood contains the vital principle. It is carrying, of course, prana. Now, of course, the number of red cells in the body varies tremendously from person to person. And I think we need to spend a little time considering this for a moment. Science will, or the medical profession, will decide how much hemoglobin you've got in your body by the number of red cells you pack into a cubic millimeter of blood. A cubic millimeter of blood, or a pinhead of blood. That's why I gave you the pinhead. And whenever you read or look at a medical report of a person's blood, and if it helps you, look to see how many red cells they have got per cubic millimeter. A male will have 6 million red cells per cubic millimeter, or you will see the hemoglobin percentage of the individual. The hemoglobin percentage of the individual. Normal male, 100%. The amount of hemoglobin in the red cells, 100%. That would be normal, or they would show you the number of red cells. So that might help you sometime to decide whether the person was anemic. Women tend to have slightly lower figures. The average female might have 5 million red cells. It varies from country to country and elevation to elevation. The hemoglobin may be 9%. If the female has bled quite a lot in her periods, and she has not replaced the blood losses, then the hemoglobin percentage in the female may go down to 60%. And you would look for signs in that person. You would draw the lower lid down and see if it was whitish, which would indicate that the red cells were deficient in the little blood capillaries inside the lower lid of the eye. Then you ask them questions and so on, which would soon tell you that the person was anemic. Now, the strange thing is that these red cell counts go up with altitude. They go up with altitude. So, a person living in Tibet may have not 6 million red cells, but 12 million red cells. 12 million red cells. Why? Because he's living at an altitude where oxygen is rare. Therefore, many more cells are required to carry the same amount of oxygen that he requires for his tissues. And so we get an idea that the red cells provide health, but at the same time they can provide, if they are deficient, they can provide the individual with anemia. Then we come to the next kind of cell in the blood, and these are known as the white cells. So here we have got a section of blood, and here are red cells all over the place in the slide of blood, red cells. But in amongst them, only about 1% of all the cells, you find white cells. White cells. They're slightly larger than the red cells, and they have an unusual shape. There are two kinds of them. So scattered in amongst the red cells, you will find every now and again, you will find the white cells. The first one that I've drawn, the larger of them, we can call this a polymorph. Polymorph. Poly means many, morph means shapes. Polymorph, that means that the cell can alter its shape. And indeed, you might see a cell looking something like that, or like that, or like this. It has many shapes, but they're all white. There's no pigment in them. White in the sense of being unpigmented. And occasionally you will find a lymphocyte. Lymphocyte. These are called, there are others, but these are the main ones. These are called the white cells of the blood. The white cells of the blood. And they're about 1 in 100. 1% of the blood is white cells. In fact, we go to the usual scientific method of saying, well, how many of these is in a cubic millimeter of the blood, or a pinhead of blood? And we find that the polymorphs in you and me are about 5,000 to 10,000. In fact, it's about 4,000 to 10,000. And that's a normal count for polymorphs in the blood. 4 to 10,000 in a pinhead of blood. Not 6 million like the red cells, but 4 to 10,000 in a pinhead of blood. Lymphocytes, or a few more, perhaps 6,000. And that represents the blood. Let's put a little bit of yellow plasma there, the sticky material that they float around in, and we've got a good blood smear. I should have to put lots and lots of more red cells there. Now, what are these polymorphs? Let me draw one, enlarged. There's a polymorph, enlarged. Now, its nucleus, instead of it being just a little round nucleus in a cell, its nucleus has 2 lobes to it. The lobes are attached, look like a pair of Mae Wests. Do you know what a Mae West is? Used to have them during the war. Yes, it was something you slung around your head if you were on a ship and could be torpedoed. And then you have, that's the nucleus. It's a bilobe nucleus. There's a lobe of your ears, 2 lobes of the ears. A bilobe nucleus. And that's the polymorph. Now, it alters its shape. What does it do? It practices what we call amoeboid movement. It alters its shape and moves around. There's its nucleus. It's altered its shape, and it's moving perhaps it's going to move between two cells. There's a cell there and a cell there, and it can slip between two cells, and that's known as amoeboid movement. Amoeboid movement. This white cell can change its shape. It's a polymorph, many-shaped cell, and it can change its shape and get in and out of things. It can attack tissue, dead tissue, and it can engulf the tissue. So what I'm going to draw now is, if you watch very carefully, here are some bacteria. They're the same, they're almost the correct size in relation to the other cells. They're in the blood, some bacteria in the blood. There they are. Along comes a polymorph. Amoeboid action, it moves towards them, and immediately it attacks them. It alters the shape of its body and starts to engulf them, surround them with its body. And this is known as phagocytosis. Phagocyte, phagocytosis. Cytosis means a cell. Cyto is a cell. Phagocyte, the destruction or the engulfing of cells. So there is stage 1, A, shall we say. There's stage 2, B. Here's the third stage. There are the germs, the bacteria, and they're completely engulfed inside the cell. There's its nucleus. There are the bacteria. Now this is phagocyte. It's a polymorph. It's a white cell which is able to eat up, if you like, these germs, pieces of soot, dust, poisons, toxins, anything in the body that is foreign to it. These white cells attack. Later on we will do something on inflammation, what inflammation is. So here we have these white cells performing a very, very important task. Their task is to remove debris from the blood. Dead tissues where the tissue cells have died, those need to be cleaned up. Now, when we take penicillin, the effect of penicillin is to make it easy for the white cells to attack bacteria. And the bacteria, especially, are a variety which are known as Staphylococcus. A coccus is a round bacteria, C-O-C-C-U-S, coccus. We'll have an evening in which we'll describe the various bacteria. A coccus is a round bacterium. There they are there. Staphylococcus is the most prevalent. Staphylococcus is the most prevalent of the bacteria in the body. It causes pimples, sore throats, upper respiratory tract infections, boils, anywhere in the body where you get some festering. Staphylococcus. The effect of penicillin is just as they say very crudely, the effect of penicillin is to butter the bread so that it can be eaten. The effect of penicillin on these cocci is that the white cells can attack them more readily when penicillin when they've been engulfed faced with penicillin. So penicillin is an antibiotic. It's an antibiotic which enables the white cells to deal more adequately with certain kinds of germs, the Staphylococcus germs. Now, we've talked about the white cells called polymorphs, but what about this one here, called a lymphocyte? The lymphocyte is equally important. It takes a little longer to work, but when the lymphocyte really gets working, it is the most effective defense mechanism of all. Beginning to get the feel of the blood. The blood is a transportation system. The blood is a defense mechanism against invasion or defense against toxins, foreign bodies. Now, what does the lymphocyte do? The lymphocyte produces or makes what we call antibodies. Antibodies. Let us say that you have got a tetanus toxin inside of you. You've gone and cut yourself on a rusty old nail, which is a typical place to get tetanus infection. Anywhere where there is cow dung or horse manure, that sort of thing, get a cut to get an anti-tetanus injection immediately. The tetanus germ will make toxins. Let's say that the shape of the toxin is this shape. That's the shape of the toxin that it's making. Tetanus toxin is like that. The moment that that toxin moves around the blood, the lymphocytes and the places where they reside in the lymphatic system of the body, the lymph glands, the lymphatic system and nodes, the lymphocytes immediately begin to produce an antibody for that antigen. This is the toxin called an antigen, which could be picked up by infection or injected into you, or a poison which you've taken. Whatever it is you take into your body that is foreign in nature, the lymphocytes will begin to make an antibody that will pick it up. So let us spend just a little time and put this lymphocyte in enlarge like this one. There's the lymphocyte with a huge round nucleus. See how much space the nucleus takes up, and it doesn't change its shape like the polymorph. It begins to make lots and lots of antibodies to try and trap the tetanus toxin. There's the tetanus toxin floating around the body. The antigens pick them up. The antibodies pick them up, and they cause them to clump and become useless. They become non-poisonous, non-toxic. And so the lymphocytes provide us with what we call immunity. If we have a disease, our lymphocytes make antibodies to offset the disease, the antigens of the disease. And in measles, those antigens remain with us for the rest of our lives. The antibodies remain with us for the rest of our lives. We're immune to measles because we've got antibodies flowing around our bodies, in our blood, which will clump any measles toxin that it's presented with. You understand that? Similarly, we take our babies and we inject them with material to make them immune against polio. What are the others that they do still over here? Diphtheria. Diphtheria is almost a thing of the past, isn't it? Wonderful. Pardon? Meningitis? I don't think they inject for that to begin with. Never mind. You know what I'm talking about. The lymphocytes provide the mechanism of immunity, and they're in the blood, lymphocytes. So, now we can start to talk about that which conducts the blood. And these are what we call blood vessels, the blood vessels.